Hi there, I'm Lori Edge-Hughes. I'm one of the co-owners here at the Canine Fitness Center, and I wanted to create this video for you to detail a little bit about the process of what you might expect and what it is we do here at the Canine Fitness Center. So I want to lay out the process that would be involved. And what we've found first off is that people find out about us in several different ways. Some have heard about us or have been told to contact us from their vet. Others have heard from some of our past clients, and some have just found us online with Googling to see what's available. So either way, when you call in, we'll get some information about you and your dog, and part of that is going to include who is your veterinarian. And from there, what we're going to do is send off a referral request. So we want to communicate with your veterinarian, get information about what he or she knows and has done with your animal. And there's two really important parts with this. Is one, it's going to establish a communication back and forth, which is great because then both of us are on the same page. So your vet knows what we think and what we're doing, and we know what your vet is thinking about the case and your dog in particular, and what he or she is doing. And it also fosters a bit of collaboration, so we can both be working together for the benefit of your dog. And most importantly, so any case that is post-operative, lame, injured, or simply just old, we really absolutely must have some communication with your vet. So that's first and foremost, but we'll do that for you, just so that you know that's the process we go through. Now, when you come in, you can expect 1 page of paperwork, nothing too traumatic, and just questions: name, address, dog, age, etc., medications, those sorts of things. And it's just pretty basic stuff, nothing too skill testing. But just so that you're aware that if you have a very anxious dog or a very exuberant dog, or even perhaps if you have a dog that doesn't like other dogs, it's perfectly okay if you wanted to leave your dog in your vehicle, come in, fill out the paperwork before going out and getting him or her. That's totally fine with us. So just to be aware that you will have some paperwork to fill out. Now, we will be scheduling about 1 hour and 15 minutes for that initial assessment, and this is going to allow for assessment, a bit of treatment, written home program often, and will allow us to fill out some of the paperwork so that we can provide the written communication back and forth with your veterinarian. So that's on average how long it takes. Sometimes a little shorter, sometimes a little longer, but you should expect at least 1 hour and 15. Okay. Now, when you go into the little private treatment room with the therapist, she will start by conducting a subjective assessment, which is basically nothing more than asking you questions. History of this present injury, when did you start to notice that your dog was limping, or what was the date of the surgery, or what are you noticing the abilities of your dog? What makes him worse, what makes him better, those sorts of things. So it's just to give us a bit of a background about what's going on now, also past medical history, but it's also is time then that your animal can get comfortable, you can get comfortable, and it's just kind of a nice little way to break the ice and get started, and much nicer for the dog that is especially a little bit anxious. Okay, so then we're going to go into the objective assessment, okay? And it always starts with some gait analysis. Now, your therapist may have been watching your dog walk around the room and may have noticed some things just with that, but we're going to look for things like, is there a head bob, a hip hike when they walk that would indicate which leg is lame? It might just be how they are in stance, and do they offload one leg versus the other? And that's basically is just a way of honing in to say, okay, well, that's our suspected leg. Nothing more than that, and it's just, again, a nice, easy way to get started. Then, after we've watched your dog move, we're going to do the palpation portion, so the hands-on assessment. Now, just for those of you who maybe do have a dog that's aggressive, I want you not to worry. We definitely deal with all types of dogs. Mostly we don't ever have to use the muzzle, but if you are worried about your own dog, certainly know that we have several different sizes of muzzles if need be. Most often, like I said, we don't need to use it, but certainly if you have concerns, please bring them up and we can accommodate that. Okay, so now we're going to get into the palpation where we're trying to find the sore spots. A good therapist usually always goes to the suspected area last. So when we were watching the gait assessment and whether the dog was offloading on a leg or not, we may have suspicions about which leg it is, or you might even tell us, or it might be very obvious that's the one he had surgery on. So we're going to start with everything else except that problem area. And it's going to be a whole body assessment. So let's say it's the back right leg. We're going to, flex and extend the whole of the front leg, both front legs. We're going to do the left hind leg. We're going to look at the neck. We're going to look at the spine. We're going to look at the pelvis. Then we're going to go into that suspected or problematic leg. And in doing a whole body assessment, we're not only going to find the primary problem. So maybe that's, yes, my dog had knee surgery. That would be an obvious primary problem. But we'll also be able to find all the secondary problems. So that might be the things then that are compensations for this injury or surgery. So there might be problems in the back and with how the dog has been posturing for an extended period of time. We might even find some things that may have been precursors to that injury. So it might be that the sacroiliac joint is out of alignment, and maybe that led the animal to not use this leg as well, therefore it was weaker, therefore he damaged his cruciate ligament. So essentially we're going to be looking at everything. So if you see your therapist looking at a front leg when obviously your dog has had a back leg surgery, now you know where we're coming from, is we want to look at all of the parts of the body. And maybe we find what I call bonus problems. So it might be, well, your dog also has some elbow arthritis, and we can address that too, so that the dog is functioning, or will be hopefully, functioning better all over. Okay, now some of the things that the therapists are going to be looking for. So we're going to look for, when it comes to joint, okay, we're going to look for joint tenderness, the range of motion in that joint, the quality of the movement. Does it feel smooth and fluid, or does it feel crunchy? There are over 170 joints in the body, and I just did a quick little estimate of that number when I did a quick count. There's more than 170, but that includes all of the spine and all 4 extremity joints, and we're going to look at I picked out all the ones that I would go through on any assessment, and there's at least 170. So we're going to look for all of those things, testing out all of those things to really get a good idea about all of the joints, okay? Then we're going to look at the muscles as well. We want to see if there's any muscles that are tender. We look for tone of the muscle, so the quality of the feel, the bulk of the muscle. That might tell us, is this a very new problem or a long-standing problem? We can look at flexibility of the muscles, and when I did a quick count, there's over 90 different muscles that we're going to be putting our hands on and feeling and assessing. Okay, so good. Now, to carry on the assessment, we're also going to be aware, the therapist will be aware of and looking for nerve function and spinal cord functioning. So maybe your dog has a pinched nerve. Maybe he or she has a disc problem in its neck or in its back that's causing kind of a power outage. We're going to be looking for those sorts of things. We're also going to look at your dog's condition, strength and coordination. So those are the sorts of things then that would allow for more advanced level functioning. So even just going in the park and being able to roughhouse and do different things, but it could even be for the canine athletes as well, that, are their abdominals engaging when you lift a leg? So looking at those sorts of things as well. And we might be taking some measurements. So how are they weight bearing? What is their thigh circumference or a front leg circumference? Looking at muscles in through there. So these are all the different sorts of things that we're going to look at, and you can expect your therapist to be looking at when you come in for the assessment. Now, once the therapist has looked at all these different things, she's going to present to you a summary of the findings, and that's going to be some of the primary problems and some of the secondary problems. So it's going to be, okay, yep, your dog has had cruciate surgery. It looks like it's coming along great right now. You know, the incision's healing, or maybe it's going to be, you know, there's a little bit of oozing here at this bottom end of this incision. I want you to keep an eye on that. But, you know, and here's the other things I found, and here's my summary of not just the diagnosis, but the functioning of the animal and how is it affecting them. And from there, the therapist will kind of look and speculate, postulate on the best course of treatment. So coming up with the treatment plan, okay? And this is going to be customized for you and your dog. So it's not just about what I think is going to be best, or what your therapist is going to think is best. You are part of that process as well. And we've got to look for things then that are going to be practical for you to do, even feasible for you to do. So you're very much a part of that process, and we would definitely encourage your feedback with any of this. If for example, I know I've had to do this before where I've said, you know, walking up and down hills would be great. But this one particular person I was telling this to had terrible arthritic knees. And I said, alrighty, so, you know, is there a neighbor or is there anybody else in the house who could do that with your dog? And, you know, and in that scenario, she did have a neighbor girl who would come over and walk the dog up and down hills. But then alternately, if it's like, look, hill walking is not going to happen, my knees are going to blow out, then we'll come up with something different. So it's very much customized for you and your dog. Now, if we look at some of the treatment options. Okay, so messy page here. If we look at some of the treatment options, we might choose to use some of the modalities. So we have over 7 different options that can be used for healing, for pain relief, for proper functioning of muscles. And some of the things that we have at our disposal would be laser, cold laser, therapeutic laser, ultrasound, TENS, E-stim, electrical muscle stimulation, pulsed electromagnetic field, microcurrent, and some of the therapists also do acupuncture and dry needling. So that could be one or maybe a few different modalities that your therapist could select to help treat your dog. All of the therapists are very skilled in manual therapy. That's a big part of physiotherapy training. All of our therapists have a background in physiotherapy. So we have over 7 different options that can treat stiffness, pain, and proper functioning of a joint or muscle. So that could be mobilizations, occasionally a manipulation. We tend to stick to mobilizations, but there may be a case for a manipulation. It could just be range of motion. It might be myofascial release, so stretching out and getting the best functioning of muscles. It could be trigger point massage. It might be stretching, could be craniosacral therapy, and there's a multitude of other hands-on therapies that our therapists are trained to provide. So your therapist may select any number of these different manual therapies for your dog. And then it can also be some exercise therapy, and this would be specific muscle exercises that are going to be useful for proper muscle functioning and strengthening. So you can have generic generic exercises, which could be, you know, walking on a treadmill, going for a walk, doing those sorts of things. And then there's going to be specific muscle exercises that would be specific to building the glutes, for example, or building the quads, or working on balance and coordination. So the exercises we're going to look at are going to be very specific as well. In addition to telling you, you know, walk your dog, and here's how long you might want to start for. So some of the options we have in clinic would be our underwater treadmill. We might use the land treadmill, and we have a large matted area in the back that we can set up all sorts of different exercise equipment that it's almost like a dog obstacle course where on leash and controlled we might lead them through some different exercises and see what would be best for your dog to strengthen the specific muscles that we are wanting to target. And in going through some of these exercises too, it's going to help your therapist to figure out your home program, okay? And your home program, I always say, you are just as important in what you do at home as we are in what we're doing at the clinic. So you should get a home program. For most dogs it's appropriate. And with that, you can expect we try to make it never more than one page. We have all learned in the past that if you make it more than one page, the second page doesn't get looked at, or it looks very overwhelming, or we write it on two sides and you post it to the fridge and nobody ever looks at the back sheet. So we try to keep to one page. We don't want to overwhelm you with your home exercises, but we're going to come up with the best exercises for your dog. Now, we'll also here look at the Rehabilitation Pyramid, because what I want to point out to you are the things then that, the stages of rehabilitation that we would go through. So it's not all about, well, your dog comes in and we start them off hard on exercises. It's not that way. It's definitely very customized and very well thought out, so that what we would do when your dog is in the acute stage is certainly very different than what we're going to do when your dog is at the advanced stage. So we're just going to go through that here right quickly. So here's the Rehabilitation Pyramid that I wanted to show you. And this basically captures very well the process in which rehab moves through. So the base here of the pyramid would be where we would start, especially with any acute injury. So your treatment is going to start with usually working to control the inflammation. So especially envision a post-operative joint, and because that's easy to envision. So you've got this big, hot, swollen, puffy joint. We want to control the inflammation. So it might just be some of the modalities, maybe some very gentle hands-on stuff to help control the inflammation. We also want to control the pain. So much of the same things that control inflammation will also help to control pain. And then we're going to move into also, rather, in the same fashion, restore integrity of the injured tissues. So this might be things then that will also help the healing process. So again, a lot of the same things target these three different components. Then as your animal moves from acute to subacute, we're also going to look at different things like addressing muscle inhibition and restore control of voluntary movement. Now, muscle inhibition basically means that if you have a painful joint or a swollen joint, the muscles around it shut down. They don't work like they should. They don't work properly. So we can utilize things, for example, like an electrical muscle stim unit to try and wake up quadriceps in this knee scenario I've painted. So if we wake up the quadriceps so that, and just even have the animal weight shifting while the machine is going, so that the quadriceps remember the job they have to do. So this will address muscle inhibition and help for control of the muscles. We would also then start to look at restoring range of motion. We can't try and get full range of motion, full flexion and extension in that knee while it's still puffy, hot, and swollen. So we have to wait a little while until we start to introduce restoring range of motion. So that's going to be the next tier. Then as a little more time passes, your animal gets better and feeling better, we're going to move up a level where we can restore reflex reactions. And that's looking at some of the postural things that would go on to utilize muscles. So that could be the animal's ability to maintain its balance when we, let's say, lift one leg off the ground so that they are standing in 3-leg standing instead of with all 4. So that's a postural reflex reaction that has to occur, that the body has to know, oh, I have to turn on, I have to hold steady here. So that's a more advanced skill than just weight shifting. Okay, we're also going to look at restoring muscle strength and endurance. So when I talked about some of the therapeutic exercises that we might do in our back exercise area, these in particular are the things that we're starting to look at back there. So muscle strength could be walking up a plank, walking over a plank, stepping over obstacles, even stepping up onto a platform, all to address the muscle strength and to a certain extent the endurance. Because we have to think of endurance not just as in how far is he walking, but how long can he stand on that one leg. If I lift the good hind leg off the ground, can he stand on that surgical leg now for 15, 20, 25, 30 seconds? So that's endurance. When we move out of this phase, we move into restoring functional movement patterns. Okay, so functional movement patterns might be then the ability to turn quickly. So maybe we'll take your dog through weave poles where he has to move quickly from one side to the other. We need to retrain tug of war, playing catch, all the things that if your dog goes to an off-leash park or even in your backyard and plays with toys, we need to retrain the ability to do that in a safe environment. So we move to there, and then lastly, it's going to be return to functional activity. And that could be allowing off-leash activity. It's never an all or none. So that return to functional activity could be, okay, you're going to go to the off-leash park when nobody's there, and you're going to allow just 3 minutes of off-leash time. And then you go back on the leash so that it's controlled return to functional activities. So just so you know, this is the rehabilitation pyramid. This is how we look at taking your dog from point A to point B. Okay, so we get to point number 10, is also looking at the follow-up frequency. Okay, and again, please know that this is going to be very customized for you, and you need to tell us what's going to work for you. We can make your rehab as in-depth and as detailed as you need, or we can make it where it's a substantial amount of home program, and you come back and you check in with us, we see how things are going, and we give you more home program exercises. Okay, but basically you and your therapist will determine the frequency and the frequency plan, essentially. Coming back, you can count on your physio sessions being about 30 minutes in length. That's the typical physiotherapy session. So when you're doing the rehab with the therapist, that's usually how we book. For underwater treadmill, if that's appropriate for your dog, it usually starts at about 10 to 15 minutes and may very well, and well, usually does increase about a minute or 2 with each subsequent treatment, but it very much depends on where your animal is at. So let's say this is a post-op anything, knee, hip, shoulder, post-op anything, and it's at that mark of usually around the 3 weeks is when we could start utilizing the underwater treadmill. We make sure any incisions are fully healed. In that scenario, depending on how your dog is doing, it might just be 10-15 minutes. If your dog is already doing quite well, it's beyond that really acute stage, we might definitely start at the 15 minutes and work up from there. 15 is usually the highest that we would start at, and because we want to know how your dog does with that and whatever soreness there might be from exercising and adding a new exercise into the program. So those should be your expectations for time. As well, then, Just know that if at any point during the therapy that you have any questions, you can always call the front desk and talk to the receptionist and ask to speak to a therapist, and she'll call you back. Or you can ask for the email for your therapist and email your therapist, and she can email you back. We definitely want to help you through the process of the recovery from whatever your dog is suffering from, and we want to be there for you. So you will have access to us by phone or by email. I think that's good. So certainly if you're interested, just call. You can book in to see one of the therapists, ask some more questions when you call, and we look forward to meeting both you and your dog.